Hi, is everybody here? Can everybody just open your camera for a while? Who's the head of the group?
It's me, sir. It's me, doctor.
Siapa? Ni tu siapa tak nampak?
My name is
Razin.
Razin, and together with my assistant named Sakina.
Patutnya berapa orang dalam kelas?
The total number should be 34 students.
34. Jadi patutnya 35 kan sekali dengan saya.
Yes, true. Betul.
Jadi 5 orang lagi. Okey, tak apa, tunggu 5 minit lagi. My Wi-Fi is notoriously unstable, so kalau tiba-tiba hilang tu, it's because of the Wi-Fi lah. You just be patient. Okay. Everybody here buka kamera je, nak tengok muka. Sekejap je. What seminar am I supposed to have with you guys on Friday? Jumaat tu seminar apa? Azin, Jumaat tu seminar
Jumaat ni doktor. Doktor. Kejap doktor.
Respiratory.
Korang yang present kan? Bukan saya kan?
Betul.
Berapa orang presentation?
4 orang.
Title dia tahu tak?
Title? Ada. Bronchial asthma, bronchiolitis, pneumonia dengan acute gastroenteritis and dehydration.
Respi campur dengan AGE. Okay. Pukul berapa sepatutnya?
Pukul 8 sampai pukul 1.
Okay. I don't expect it to last 8 sampai 1 lah. I mean, you'd fall asleep by the second hour maybe. Outline your sketch. Outline your presentation, or you can do the presentation first. And then if you need feedback, you email me minimum by Thursday morning. Faham tak? Kalau nak feedback. Kalau tak nak feedback, up to you guys. Because you guys are adults. Okay, my email kat chat room. So who are the presenters? 4 orang presenter tu siapa?
Saya doktor.
Saya tu siapa? Kalau macam ni
Fauzan.
Fauzal lagi?
Farah Nadira Johor.
2 orang lagi siapa?
Ikhwan.
Seorang lagi? Mustafa nampak ni dahi je. Oh, you're scratching your head.
Yeah.
Okay, if you want feedback, you send me the presentation latest by Thursday morning. If you don't send it by Thursday morning, I assume you don't want feedback. Okay? If in between you want to ask anything, you just email me. The email's in the chat room. Sekarang dah berapa orang? 33. Lagi 3 orang. Ada orang yang cakap dia orang MC ke apa ke?
Tak ada pun doktor. Setakat ni tak ada.
Orang kat kampus ke kat rumah? Kampus
Mesti dekat
Campus.
campus, majoriti semua.
Nak tunggu ke nak start? Is your friend nak tunggu ke nak start? Bagi 2 minit lagi lah. Okay, I'm gonna we shall give your friends, shall we give your friends another 2 minutes?
Sure doktor.
Another 2 minutes kalau tak. Kalau tak hadir tu tak hadir. Let me close my window. Okay, dengar tak?
Dengar doktor.
Okay, sebab I just put on my headphones. Okay, so today's topic will be about developmental milestones. All of you are in third year, right?
Yes,
Yes
doktor.
doktor.
Okay. Now, the thing about pediatrics is that one of the things that you guys need to know is about what's normal development. Okay, so there's certain, everybody develops differently, but there's certain things that kids are supposed to be able to do at a certain age. So if they don't reach that so-called milestone, then they are considered late and they need to be evaluated. Okay, so usually what happens in Malaysia is that these kids are evaluated. Not all kids will see doctors, right? So usually, supposedly, the clinic kesihatan nurses will monitor these kids during immunization. And supposedly they're supposed to be able to pick up the ones that are delayed, but that doesn't always happen. So flaws in the system. But anyway, your friends. Okay, let's close this down. Now, developments usually we divide it into 4 big categories. So usually gross motor are the big movements such as running, jumping, walking, crawling. Okay, then there's fine motor and vision. Fine motor and vision goes together because basically fine motor is things like writing, picking up objects from the ground, hand and eye coordination, fine motor, you need vision together, isn't it? Right? Language and hearing, obvious reasons. So this is, we are talking about verbal language, right? In order to develop verbal language, you actually need normal or near normal hearing. Okay. Social behavior and play. Age milestones, we go by, usually we go by age group. So these numbers are arbitrary, but usually you tend to go by this. By 6 weeks, the kids are supposed to be able to do what? By 3 months, they're supposed to be able to do what? 6 months supposed to be doing what? 9 months supposed to be doing what? Usually when we talk about milestones, we don't usually say 7 months or 8 months, because there are things at 9 months that kids are supposed to be doing. 7 months, 8 months, it's neither here nor there. So usually the age ranges that we go 6 weeks, 3 months, 6 months, 9 months, 12 months, 18 months, 24, then after 2 years old, then you go by 36, by yearly, 3 years old, 4 years old, and 5 years old. Okay. Now, the first thing that you need to know about, the first thing that you guys need to know about is that about primitive reflexes. So primitive reflexes are involuntary motor responses which originates in the brainstem. Okay, they are present at birth, in early childhood development, and they facilitate survival. So things like rooting reflex, sucking reflex, those are already present at birth because they help the kids to know that they're supposed to be drinking from the tip, right? So they feel something at the side of the mouth, and then they start rooting and turning their heads toward it, and they look for a tip and start sucking on it. So that's how they get milk, right? So several reflexes are important in the assessment of newborns and young infants. Most of them will disappear in the first year of life. Yes, these are some of it: sucking and rooting, palmar grasp, tapping, asymmetric tonic nut reflex, Moro's reflex, and plantar's reflex. Okay, so we can just watch a few videos.
Include the stepping,
Got sound or no sound?
crawling, and swimmer's reflexes. If an object is placed
Huh?
in the palm of an infant,
Ada
I
bunyi
can
tak?
hear, ada sound, Doctor.
Clear ke tak clear?
Clear.
Okay, then. Sorry.
behaviors. These include the stepping, standing, crawling, and swimmer's reflexes. If an object is placed in the palm of an infant's hand, the grasping reflex will be triggered. Primitive defensive reactions. A reflex that is typically measured in newborn and well baby checkups is the Moro reflex. This startle reaction is a response to a sudden, intense noise or movement. When startled, the newborn arches her back, throws back her head, and flings out her arms and legs. Then she rapidly closes her arms and legs to the center of her body. Each reflex has its own developmental course starting at different gestational ages. Some reflexes persist throughout life, such as coughing, yawning, and blinking reflexes. Other reflexes disappear, typically between 3 and 6 months. It is believed that as the development of the brain progresses, voluntary movements take over and the reflexes are suppressed. Doctors continue to assess these reflexes during routine well baby checkups to make sure that particular reflexes disappear as scheduled. This tells us that the infant's nervous system is developing normally.
Okay. So generally, the primitive reflexes by the age of 1 year, they should already disappear. But if after the age of 1 year, these kids still have the reflexes, these kids still have the reflexes, then it shows that possibly something is wrong with the development of the child. That's why it's important for you to know about the reflexes, okay? Now, this video doesn't have audio, but we have subtitles.
orang anaknya orang sakit. Ya. Macam kawan menunjukkan perbualan antara 4 orang. How many fungsi teachers ada? What? Four. One. Each person has one teacher. Saya berhadiah khusus saya kepada 8 potong. Saya makan 3 potong pizza sahaja. Yes.
Okay, so that's just another video that's showing you guys the primitive reflexes. Okay, so that's just about primitive reflexes. Then we're going to go to the developmental milestones.
Yeah.
Okay. Birth to 5 years is a little bit too long, so I'm going to break it down to about each group to about the age of 1 year, first 6 to 1 year. And then after that, we're going to go to 18 months to 5 years. Okay, then we're going to go through red flags, go through a few causes of developmental delay, and just look at a few videos about developmental assessment. First off, we're going to start off with 6 weeks to 1 year. Okay, so when you guys just start learning, right, it's easier for you guys to learn about progression, meaning this kid, what they are supposed to be able to do sequentially, right? Meaning you learn like A, then B, then C, then D, then E. Try not, if you learn sequentially, it makes things easier. So when you do a developmental assessment, if the kid can already do C, right? That means he most likely can already do B, right? So instead of going backwards and testing B again, you can just go on and test D. Do you get what I mean? Because when we do a developmental assessment, there are a few ways to do it. Either we give you this kid, we tell you this kid is 5 years old, and then we say, can you please do a developmental assessment and see whether this child is appropriate for age? Okay. Another way is that you can get a kid and then we just ask you to assess what is this child's developmental age. Okay, so let's just say the kid is 5 years old. Okay, so if the child can already walk, you don't need to test that the child knows how to crawl. Right? You can just go on to straight testing whether the child can run or not, and then whether the child can jump with 2 feet. Right? Gross motor is very obvious because gross motor usually you tend to notice, right? If it's things like fine motor, then it becomes a little bit harder for you to remember. So like knowing colors, black and white is the last. You learn the primary colors first, so red, yellow, blue first, and then the secondary colors, green, orange, and purple. Finally, progressively, then they'll learn white and black. So if the child already knows what purple and purple and green is, the child would have already known what or yellow and red is, right? So you don't need to, if already you give the child a book and a bouquet, oh, this is a purple book, right? That means you don't need to go back and test at the child, whether the child knows what a blue book is. Get what I mean? Right? So that's why it's better for you guys to learn progression. So A, then B, then C, then D, then E, rather than you guys learning, memorizing by age, right? Some kids will memorize by age, that means vertically like this. So 6 weeks, some people will memorize across the developmental group. So they would say, oh, 6 weeks, gross motor must be symmetrical, must hold up head, fine motor, able to track 90 degrees. Language and hearing, they started to sound. So if you learn, if you memorize in that manner based on age, if the child's development may not, the child may be delayed in certain areas and may be normal in certain areas, right? So if you memorize based on age first, when the child suddenly cannot do what he's supposed to do at that age for all the whole developmental groups, then you guys might get stuck, right? But if you memorize in terms of progression, A, B, C, D, E, if the child can already do D, then you just go on to F, G, H, right? If the child can do B, then you go to C, D, E, then you don't need to go back to A, right? Obviously, you need to know age range also, but first try to remember progression, then only put in the ages. You get what I mean now? Okay. Now, gross motor at 6 weeks, symmetrical movements. That means they move both right and left at the same time, basically. Holds head up, but it's unsteady. Right? Head. Okay. Also, gross motor. It's by progression, so caudal to top to toe. So usually what happens is that there's head control first, okay, then there's truncal control, then they can bear weight, then they start to walk, then they start to run, then they start to jump, right? So it's head downwards, that's the progression of it. So 3 months, they lift hands and shoulders off the floor, they pull to sit with little to no head left. 6 months, these are the things that they're supposed to be able to do. Head control is complete. Right? That means if you pull them up, their neck is quite stable. There's no headland. Right? They sit with support with a round back. They are able to bear weight. Bear weight meaning if you lift up the child by their armpits, right, and you put them on you put their legs onto the surface. They are able to hold up their weight on their legs. Later on, when you see the videos, I'll show you. At 9 months, they sit unsupported in a tripod position. Tripod is in a triangle, right? Triangular shape. Okay. 1 year walking begins. Pull to stand and cruising. Pull to stand meaning they can pull themselves into a standing position, cruising. Some kids never crawl. Okay. Some kids, they are bottom shufflers. So from sitting, they straight away start walking. So those kids tend to walk a little bit later. But as long as they don't go past 18 months being able to walk unsupported, then it's okay. Okay. Fine motor and vision. At 6 weeks, they fix and follow about 90 degrees. So in your developmental kit, you have that red color ball, right? The red color fluffy thingy. Pom-pom. So you use that, and then you'll be able to see that the kid's able to fix and follow. So fix and follow. So 90 degrees is here, about here, right? So when you move the ball in front of the child from here to here, they'll be able to, not so much the head, it's more of the eyes. The eye movement, they'll be able to track the ball moving for 90 degrees. Okay. 3 months, own hands meaning they're starting to have hand regard. That means they realize that, oh, look, I have hands. All right, so they'll be able to look at it a little bit. Reaches and grasp, and then they do a palmar grasp. So a palmar grasp would be like that, right? So if there's a thing there, then they grab it away. Okay, that's a palmar. 6 months, also palmar grass. About 7 months, they start transferring. Transferring means this, go here, then they go back here. 9 months pincer, developing. Now this is a mature pincer. The thumb and the forefinger, this is a mature. Sometimes they'll start off in an immature. So immature might be a palmar approach. So they go like that, and then they grab the thing. If you test for pincer grip, then it must be something small. This would be too big, right? So usually what you do is raisins or little Smarties. But at this age, be careful with hard candy because kids can choke on it, right? Never give a child less than 3 years old hard candy because they can choke. So usually in your kit, I think it's a bead. So that bead, make sure that the bead is stuck onto a piece of string, right? And then when you test the bead, you put the bead in between your fingers, and then the string is here. So that if the kid grabs it, at 9 months or so, they start to mouse, right? When the kid grabs it, you can grab it back before the kid stuffs it into the mouth and get a choking hazard. Okay. 1 year mature pincer, object permanence. Object permanence meaning if the thing drops, they know that the thing has dropped and they look for it, right? Or if you hide a toy under the blanket, they know that the toy is under the blanket, right? Pointing, you have to point what they want, marks on paper, right? So if you give them a pen, they'll hold it and then they'll just, not real quite scribble out, they just like make little marks on the paper. Language and hearing, 6 weeks, they'll steal and count to sound. 3 months, they'll squeal. 6 months, turn to sound. Startles, babbles. You can do about the distraction test. The distraction test usually about 7 to 8 months. The nurses in the clinics are supposed to do it now. But you need 2 people to do a distraction test. The person testing would be sitting in front of the patient, right? Then you have a helper at the back. Right? So what happens is that you play with the kid first, the person in front will play with the kid, right? Now the person behind will either ring a bell on the right or the left. If the child should either, sometimes they don't turn the whole head, sometimes it's just the eyes looking towards the right or the left, acknowledging that there's a sound. Okay. 9 months understand? No. 1 year first words, response to name points. Social 6 weeks, smiles. Social smile, that means we smile to the kid will smile back. Nothing much between 6 weeks to 6 months. Laugh, but 6 months is squeal, laugh. 7 months a bit of stranger anxiety. Sorry about the typo. 9 months, also stranger anxiety. About 1 year waist peekaboo. Drinks from a cup. They put objects in the mouth. Okay? So that's up to about the age of 1 year. After that, 18 months to 5 years. Now, usually before the age of 1 year, if there's a delay, the nurses should have picked it up during immunization and should have referred to the pediatrician already. Okay. 18 months, gross motor walking should be accomplished. So any child that doesn't walk unsupported by the age of 18 months will need a referral. Okay, almost all kids should be able to walk by the age of 18 months. If you do your rehab medicine posting, you might get confused because I think they tell you that it's 2 years, but that's 2 years with therapy. Okay, but from a pediatrician point of view, if the child is not walking unsupported by the age of 18 months, that's already a red flag, so they need referral. 2 years more advanced, so they run and they jump with 2 feet. 3 years climb stairs, tricycle, easy to remember, right? 2 years run, jump with 2 feet. 3 years tricycle obviously have 3 wheels. 4 years hop on 1 foot. 5 years skips, jumps over small obstacles. Fine motor. Now, fine motor after the age of 1 year is mainly testing. You have your blocks and you have your pen, right? So first off, they start off with scribbling. Okay, back and forth scribble with an immature grip. So an immature grip would be, give me a second. Sorry. So there's scribbling, then there's back and forth scribbles, then there's doodling, genuine scribbling, and then there's shapes after that. Now, this is why it's important for you to know your progression, because later on it makes it easier. So at 2 years, straight line, they can copy a straight line. Okay, 3 years, circle, 3.5. Then after that will be a cross. After rectangle, 4 sides, 4 years old, right? After that will be a triangle and then a diamond. Now, so first thing first is scribbling. So immature grade usually is like that. They hold the pen like that, okay? Unless the kid has been sent to kindergarten very early and been forced to hold the pen like this, right? But if you leave them to their own devices, this is how they do it first, okay? Now, first thing would be marks. So they'll just hold and whatever lah, like that lah, okay? After that will be back and forth scribbles. So that'll be that, right? They might do this after that, okay? But this is not the circle of a 2-year-old. Understand, huh? Right? This is basically still just scribbling. Okay, after that, 2 years, then they can draw a straight line. So straight line, right? Usually what you do is that you draw for them and then they are supposed to follow, right? After that will be the circle. Now circle have to be, the ends have to meet. Okay? And then draw big for them lah. Give them a piece of paper and draw big for them. If they do it this way, didn't meet, right? That's not a circle. Okay? Circles must meet. Okay? If it's a slight crossing, like that, still acceptable. Okay. After that, cross, square, triangle. Now this is where I told you guys to do progression, right? Because if your child is 5 years old, she can already draw this. Then don't need to test whether the child can draw this. Right? You already know, okay, you can draw a triangle, most likely appropriate for age. Right? But if the child is 5 years old and he cannot copy this, right? Then you know, okay, I need to go down 1 step. Right? So you go down 1 step. Can do this or not. Right? If cannot do this, then go down 1 step. Right? So if you know progression easier, rather than if the child is 5 years old, and then you just remember that the child is supposed to be able to do a triangle, and he doesn't do a triangle, then you're going to be stuck. If you didn't remember progression, then you're going to start to go, okay, 2 years old is circle, then after that 3 years old is, then it becomes harder, isn't it? Right? But if you know progression, then you can just go up and down. So that's scribbling. Then about towers. Towers usually they go in the 3 times table, multiplications of 3. So 3, 6, 9, 12, right? Sorry. Right. So if you look at it, 3, 6, 9. Okay. 6 block steps, 10 block steps. So later on, you see in the video, usually what you do is you make a game of it, right? You build tower, just tell them, let's see who can build the tallest tower, right? At the end of it, the payoff is maybe you can just make the tower fall. That's a fun thing, isn't it, right? So if you want to remember in terms of towers, it's remember in terms of completed age times 3. So completed age 18 months, 3, 2 years, 6, 3 years, 9. Okay, 6 block steps. You know what 6 block steps is not? 6 block steps is staircases made out of 6 blocks. So this would be a 6 block steps. Okay. A 10 block steps would be okay, this would be a 10 block steps. Somebody is disturbing me. Hello, everybody. You're recorded, you know. Wait, later on when they review this, your face will be on the lecture.
Oh.
Okay. Now, going back to fine motor. So the first line would be the cubes, right? So 2, 18 months, usually 18 months like 3, 2 years 6, 3 years will be 9, or you can do the bridge, okay? Or the choo-choo train. The bridge, make sure there's a gap in the middle, right? The gap there. After that, be 6 block steps and then 10 block steps. Drawing, copying from a model. So you draw first and then let them copy. And that's that one for that one you don't need to remember because psychologists also use it to assess the child psychology actually. But anyway, the bottom one is the way they hold their pens. So there's a palmar grasp, there's extended fingers, and a dynamic tripod. Dynamic tripod usually by the age of almost 5 to 6 years, then only they get the normal way of holding. Language and hearing. 18 months should have about 6 to 20 word vocab and follow simple instruction. Simple instruction will be one step instruction. Pick up the ball. Okay. 2 years, 2 word sentences. So nak air, nak tidur. One drink milk. Eat bread. Okay. 2 out of 4 speech understandable to the parents. So about 50% is understandable to the parents. At 3 years, counts to 10. Counts to 10 is rote counting. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That it's not, doesn't mean count with meaning. Meaning you show them three marbles, they straight away can tell you that's 3. No, it means rote learning. So they memorize that it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right? So they can actually count, but they wouldn't know straight on that's 3. They don't know the meaning. Okay. On, in, under, that's prepositions. So this one also, we remember progression. On, in, under. So on and under and in comes first, right? Then front and back, then finally in between. Okay, so if the kid knows in between, they should know on, in, under already. Okay. 3/4 of the speech is understandable to the parents, so about 75%. So you see 2 years, 2 over 4, that means 50% speech understandable to the parents. 3 years, 3 over 4 speech is understandable. 4 years, 100% understandable, 4 over 4. Okay. 4 years more fluent, 3 colors, in front, behind, between, behind, actually in front, behind first, then in between. Okay, 5 years they progress from there. Social, 18 months spoon feeding, they can mimic housework. 2 years they start toilet training, they are able to remove clothes. Parallel play, that means they play beside other kids, but they don't play together with the kids. 3 years they can share, make believe play. Okay, so make believe play, dressing up. Okay, making things up, right? So they can say this egg is a car. Okay, first usually what starts off with imaginative play is that a car is a car, so the car vroom vroom, right? After that they progress to be able to substitute things for the toy. So obviously this is not a car, right? But they can say, look, this, I'm going to imagine that this is a car. Vroom, vroom, vroom. Okay, so kids who are on the autistic spectrum have a problem with this one, right? Because they are more literal in ways of thinking. Okay, taking turns, dresses, self, buttons, 4 years, and that's it. Okay. I think you want to ask about milestones first or not? You don't have that, I'll continue. Okay, going on to red flags. Now, red flags are if a child doesn't do something by a certain time, he or she needs evaluation. It includes plateauing. Plateauing means the child reaches a developmental milestone and then after that doesn't progress. So the child is able to walk, but after that unable to run. Okay. Regression meaning the child can do something and then after that they cannot do it anymore longer. Okay, so regression would be like the child was able to walk, able to run, then after a while stop running, stop walking, or the child is able to talk, already have 2-word phrases, and then after that they regress, they lose their words, unable to have words with meaning, right? So some kids on the autism spectrum will present that way with regression. Okay, so some of the red flags, this is basically just a list of some of the red flags that you would see. At birth, is there's an asymmetric Morose reflex. So Morose reflex is when you startle the child, the arms open, the legs open, and then they close back again, right? So if only one side is moving, they might show that if it's like immediately after birth, there might be a birth injury, right? Brachial plexus injury, maybe in a big child, infant of diabetic mother, macrosomic baby, so they had a difficult delivery. So the child developed shoulder dystocia, brachial plexus injury. So when you do the Morose reflex, only one side moves, right? So hearing assessment, all babies that are born are given a hearing assessment before they are discharged from the hospital. Okay. 3 months, there's no head control, there's no smile. These are red flags. All these kids will need referral. 6 months, some of the primitive reflexes are still present. There's fisting. So just now we already told you, right, about 3 to 4 months, there's hand regard. When the kids start to notice, hey, I have hand, then they open and close, right? They reach out. If they're still fisting, meaning at 6 months, they're still just doing this, right? Not opening. Okay, they're just doing this. So this is a red flag. Okay, that's the thing. Hand preference doesn't come until at least 18 months. So if they are consistently only using one side, only consistently using the right side or the left side, also might be a red flag, might be something developmentally wrong with the child. Okay, minimal response to people and noise. 9 months not weight bearing. Okay, 12 months not sitting, no words. 18 months not walking. So cutoff point for walking would be 18 months. Mouthing meaning you putting things in the mouth, drooling. 24 months, less than 5 words, not interactive. 36 months, not interactive, no 2-word phrases. Usually the older kids will present with school problems. Okay, this is basically just a list of causes for developmental delay. Lots of things. So, but the developmental delay can be isolated. So sometimes the child may just have gross motor delay, so child with spinal muscular atrophy, right? Or child with cerebral palsy, also might be just a gross motor delay, right? Or the child might be delayed all across the board. But even if they are delayed all across the board, right, both gross motor, fine motor, social, language, and vision and hearing, the delay in each component might be different, right? So they might be more delayed in gross motor, but there's less delay in speech. Okay, doesn't mean that if you're delayed, the child is delayed, the child will be delayed all across the board with the same type of delay. Okay, so abuse can cause delay, usually global. Malnutrition, cerebral palsy mainly motor, because not all children with cerebral palsy also have mental deficiencies, right? IEM, inherited disorder, Duchenne's muscular dystrophy, SMA, spinal muscular atrophy, syndrome, trisomy 21 is Down syndrome, structural abnormalities of the brain, slow school progress. Can be a hearing problem, can be a visual impairment. Some kids might have learning difficulty, dyslexia, dysgraphia, dyscalculia. Okay. Poor social skills, usually autism spectrum disorder and ADHD, like attributed to that. Some of the causes. Now, so in developmental assessment, first thing is that you must make sure that the child's developmental is within normal range. If not, then you must decide how abnormal it is. Okay. So if the child is delayed, so usually if a child is delayed, if we talk in terms of developmental age. So what you would normally do if the child is 2 years old, we would say that the child's gross motor development is roughly 18 months, equivalent to 18 months, right? Or if the child is 2 years old, then we say the child's gross motor is equivalent to 9 months. So that will give you an idea how delayed the child is, right? Try to be systematic but flexible. Yeah. If you do a developmental assessment on a child, basically you have to go with the flow. You cannot force a child to do something if the child doesn't want to do it, right? Especially if the child is very much younger. 2, 3 years old, no way you can force a child to do something that they don't want to do. 5-year-old, negotiable, depending on how agreeable the child is, right? And then you have to also remember that all skills will overlap, right? So gross motor, or it's not just gross motor. Gross motor also plays a role in fine motor. Fine motor and vision. If you want to test fine motor, you want to test pincer grip, the child must also be able to see your resin, right? Language and hearing, if the child must be able to, their receptive language must be good in order for them to be able to follow your instructions, right? Social behavior, obviously if a child is on the severe end of the autism spectrum, you cannot ask the child to sit down here, draw this, draw that, right? What color is this, what color is that? They won't be able to follow your commands. Okay, so what we're going to do now is basically just watch videos on how to do developmental assessment. When you're in the ward, the important thing is that you practice on normal kids first, so that you know what's normal, right? If you have an adik or you have a cousin, you just play with them and see what's normal. You test out what's normal first before you can identify what's abnormal. Okay, and watch some videos. Okay, let's see. Yeah, by the way, this is a good video to watch, but this is American, this one. And then their milestones are a bit different. So you might get confused, so maybe not. Anyway, let's see. The younger they are, the less things you can do. Start off with baby, then we go infant, then we go to
Okay, Lara, welcome to your developmental assessment. This is Raphael, and I'd like you to examine all 4 domains of his development, please. Okay.
Hello. My name's Lara, I'm one of the doctors. Is it all right to examine Raphael's development today? Can we actually just pop him down here and try and sit, just because we've got a few toys and things to play with? Hello. Hello. Hey. Is he able to sit if you support him? Yeah. Yeah, should we do that? Do you want to? Hello.
Come on, Mr. Cousin.
Oh, actually, no, just while he's there, we'll have a look. Have a look. Hello. Well done. Well done. Was that a smile? Clever. You are a very clever boy, aren't you? Yes. Yes, you are. That is very clever indeed. Now then, yeah, would you like to sit him up with support? That would be great.
Can I sit where you are?
Yeah, shall we swap sides? That's okay, fine. Does he roll?
Yeah, he rolls
He
from
does
the stomach to his
roll.
back. Do you want to say that
Perfect.
first?
Not necessarily, that's absolutely
And
fine.
he's going from his back to his side as well.
Okay. That's it. Yeah, so if you sit him up, I just want to see what he's like playing with these. There you go. Now then. What's this? Would you mind just turning him so he's facing me? Thank you. What's this? What's this? Hey? Would you like to hold that? Or what about this? This one might be a bit big, I think.
I'm interested in you.
I know. Would you like to hold these for me?
I'm holding your arms, baby.
What's this? You're looking, aren't you? Yes.
It's your dress.
Do you think the
The
patterns?
black and white.
Okay. No?
Not bothered with hers, really.
How about this? Is that easier for you to hold? What's this? What's this? Okay. All right. Now then. Now then. Hey. What's that? Lovely. Okay. Can we just stand you up? Let's just see what you do. Let's have a look at your toe. Yes.
So this is bearing weight.
Well
okay?
done. Oh.
So this part of it is, one is looking at toner, right? See head control, whether can sit, whether the back is straight or not, but this is bearing weight. So if you put the child up in this position, by right, the child, if the child is over the developmentally about 6 months old, they should be able to bear their weight on their legs. Okay. Even when you look at the child sitting just now, see this is a straight back, but still need a little bit of support. So roughly about 6 months, not quite 9 months yet, right?
What's that? What's that for me? Well done. Oh, well done. That's really good. Really good. Now I'm going to do tummy time now. Have a look that way. That's a lovely head control, isn't it?
Dribble.
That's all right. Being his tongue.
Yeah, that's
We
right.
I'll just move these out of the way. Let's have a look. Now there. Let's pop you this way. You can have some tummy time. Put your arms out for me. Yes.
Go on, over you go. I
Fantastic.
was trying to go over.
He's got nice head control there, and he's weight control on his forearms. Are you going to do a roll for us? Maybe.
Got too much clothes on.
That's
I'm
all
gonna do it
right.
Just in a baby dress.
Oh. Hey. Should we go back? Hey, should we go back to Mum? That's fine. You want to pick him up and bring him back? Lovely.
Big boy, he did well.
Okay.
Do you want to see his tummy? If I strip him down, he can do it.
No, that's absolutely fine. Just a couple of questions for you. Have you had any concerns about his vision or hearing at all?
No.
No. And was he born early?
Yes,
or?
11 weeks early.
Okay. All right.
And they AOK'd his eyes and his ears. And he
Good.
had
So
an
he's had
MRI.
all the checks and everything. Perfect.
He's just
Okay.
not really interested in toys, he's interested in people.
Yeah. No, that's fine. Do you see him pick objects up?
Yeah,
When
he
you're
was
at
just
home?
sitting in the pram
Yeah.
playing with that thing. He holds his, I've got a little set of keys.
And he
Plastic
likes
keys,
that.
he likes those.
Yeah.
He
Okay.
grabs toys all the time actually. But
Good. Good.
if he's around new people,
Yeah. No, that's
He's really
fine. He's not
interested
just
in
not very
people.
interested in these ones, are you? What's this? Hey, what's this?
isn't it?
You want to show us? Have you seen him pass objects from side to side yet?
Yeah.
Yeah.
Bigger ones than that though.
Yeah. That's
And
all
two
right.
hands.
Oh, Hannah might be going to bring us some extra. There
This
we
he
go.
loves.
See rag. Shall we play with
This he
this? You show me.
Shall I lay him down and do it? Or
Yeah.
sit him up?
Yeah, whatever you
'Cause
think is.
When he's sitting up, he's concentrating on sitting. It's that dress. I've got black and white toys.
I'm glad you like my dress. Fantastic.
Lifting the plan, right?
So he's lovely and awake and alert, and he's smiling well, not yet showing any stranger anxiety. From a social point of view, yes, that's fantastic. And from a fine motor point of view, mum report, oh, you're feeling right, he's got a nice grasp of my finger there, it's a palmar grasp. Yes, yes. So that would put him at 3 to 4 months. By 6 months, I'd want to see him transferring. I haven't yet seen that today. No.
By 6 months, you wanted to see him transferring objects from side to
So I'm
side.
talking about, yeah, so when you mentioned that he can do that, so that's something that we would see at around about 6 months.
Right, okay.
Obviously a little bit more complicated because he was born early. So as you know, we would correct for that.
So really
Yes.
it's 3 months.
So, well, so actually that's a question I'm allowed to ask. How old he is. How old is he actually now in terms of his birthday?
In terms of when he was born, he's
Yes.
5 months.
He's 5 months.
He was
But he
born
will
on
be
December the 27th, he was due on the 30th of March.
perfect. Okay.
So he's more like 3 months.
In the terms of corrected, yeah. So at that age.
Okay, so this is what you're talking about chronological age and corrected age. Your chronological age is the how long the child has been born. Okay, so the child was born 5 months ago, so that's the chronological age. The child is 5 months old, but his corrected age would be what the child's age should have been if the child was delivered at EDD, right? Got it now? So if the child was born, if the child's estimated due date was in, now it's what? Now it's October. If the child's estimated due date was in March, okay, and the child was born in January, so the chronological age would be 10 months old, right? But the corrected age would be 8 months, March. We have 7 months, okay? So whenever you do a developmental assessment on a child who's was born premature, up to the age of 2 years old, you assess whether they are appropriate for age based on the corrected age, right? So even though this child is 5 months old, you will only expect him to be able to do what a 3-month-old child is able to do, right? Because his corrected age is 3 months. Got it now? Right? That's why you see now, he's still sitting, little bit of hand regard. Sitting up only with a bit of support, but head control is good. Right? Not reaching out, right? The candidate tried to get her to reach the blocks, but not reaching out, even though the mother says that the child can. Okay, so that's corrected age and that's chronological age. So for chronological age, what is 5 months? Corrected age is 3 months.
Really, we'd expect them to be showing the palmar grasp, which you saw,
Yeah.
and then picking up objects, but not necessarily passing them across.
Okay.
So that's really good if he's doing that. And again, that would be consistent with that he's rolling, but not sitting yet independently, because too soon for that.
He did for 9 seconds the other day.
Lovely, and he's got a lovely fix and follow, and he's responding to sound. I don't think there's anything else that I would need to do at the moment. So today I've examined Rafi, looking at his development. He looks well grown but I'd like to plot him on a growth chart for his head circumference, length and weight. Mum reports that he is currently 5 months of age, but he was born 11 weeks early. So he's around about 3 months, 3 months corrected. From a gross motor point of view, he cannot yet sit independently, but does sit with support. He's able to roll, and he has good head control. So that would put him at around the age of 3 to 4 months. By 6 months, I would like to see him perhaps sitting without support. From a fine motor point of view, he fixes and follows well, and he has a good palmar grasp. Mum reports actually that he does transfer, so that would put him at around 6 months. We haven't demonstrated that today, so based on what I've seen today, he would be at around the age of 3 to 4 months. From a social point of
view, that's another way of, because the mom says can transfer, but you already know transfer comes about 7 months, right? So if you want to report what the mother says, fine, but then you need to clarify that based on what you saw. Not doing it, isn't it? Right? Even reaching out and grasping the kid wasn't really doing it.
View, he smiles beautifully, and he doesn't yet display stranger anxiety. So again, that would be consistent with the same developmental age. And from a hearing and language point of view, he responds to sound, turning his head appropriately, and makes cooing noises, which again would be consistent with a developmental age of around 3 to 4 months. So he's behaving exactly and appropriately as I would expect.
So there's a baby, less than 6 months. This one's an older child. This one. Watch this one first.
Okay, Rachel, welcome.
Purple taxi, is it? Okay.
Welcome to your development station.
Thank you.
This is Jack, and I wonder if you might be able to assess all 4 domains of development.
Okay.
Because if you're not careful, it makes
So hi
holes in the
folks, I'm
paper.
Rachel, I'm one of the doctors.
Hi, Rachel.
Thank you.
This
Hi
is
Jack,
Rachel.
I'm Rachel. Thanks very much for letting me examine Jack today.
No problem.
So Jack, you're starting with some drawing, are you? Can I see what you can draw? Well, you've got a nice palmar grasp with that pen.
Right? Look at the way it's holding. Yeah, I'll show you guys, right? So somebody who's about 2 years old will hold it like that.
And do you think you can draw a circle for me, Jack? Let's see if I draw one. Oh, you can, all by yourself, brilliant. And do you think you could draw a cross like this? Can you do that? Yeah,
Oh,
nearly. Try one more time, like that and then like that. Yeah. One, that's it. Good job. Brilliant,
well
yeah.
done.
And now let's see if you can do this. Can you draw a square like that? Yes,
Well
brilliant,
done.
well done. Jack. Now,
Oh yeah, just to remind you guys, this is just because the candidate says yes, well done, doesn't mean that the kid actually did it. Because the candidate is trying to encourage participation, right? So you have to be aware that yes, well done doesn't mean the kid did it, because the kid actually didn't, right?
now, seeing as you were so good at drawing, I'm going to take it away now and we're going to do something else.
should we play another game?
Another game. Shall I have the pen? Good man. Right. Now, this is a tricky one.
The other thing is that, remember, if you're gonna take out toys, totally keep away the previous toy before you bring out another toy, because if you leave the old toy there, then the child will be distracted by whichever toy that they want to play with. So make sure there's only one toy at a time.
See if you can make a tower, okay? And how tall a tower can you make?
Can you make a big tower, do you
A
think?
really, really big one. Okay, your turn. Go for it. You can use any color you like.
Baby.
There you go. What color is that?
Yellow.
Wow, you know your colors. Yeah. What color is that?
Orange.
Orange. What other colors have we got? Oh, you can make a big one.
Let's bring the mouse with us.
Yeah.
Red, yes.
Oh, you're very good at this. Look at that. And the last one? Brilliant. Let's count. Can you count?
1,
Mhm.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
12. Brilliant. Well done,
Well
Jack.
done.
Let's put them all here now. Let's try a few things, okay?
No.
I don't think we've got scissors or anything else for fine motor. So we'll move on now. I want to see if you can, you listen carefully, I want you to put this on your head, okay, wait a second, on your head, and then I want you to touch your foot with it, and then I want you to give it to Dad. Do you think you can do that? On your head?
So how many steps is in that command? How many steps
3.
are there? Yeah, there's 3 there, isn't it? So the single step command. So single step would be take the block, right? So 2 steps will be take the block, give it to mom. So that's what take the block doing. This will be 3 steps, right? Put this on your head, touch it on your foot, and then give it to Dad. right?
Head, and then what was next? Let's try it again. So I want you to put it on your head, and then I want you to touch your foot with it. So head, and then foot, and then give it to Dad. Can you do that? Head, and then... Oh, brilliant.
Jack, can you have it touch your head with the brick, then touch your foot, and then give it to
take it
Dad?
off your head
Yeah,
first.
then
Yes.
foot,
And
then
foot,
head, foot, and then give
Dad.
it to me.
Can you do that? Well done.
Yeah.
Brilliant.
Okay, the other thing is that when you do this to a real patient, be very mindful of how you repeat it. Your 3-step command can become a 1-step command. It's like if the kid, you said, put it on your head, put it on your head, touch your foot, give it to Dad. If the kid puts it on his head and then he forgets, and then you repeat, touch it to your foot, and then after he does it, you say, give it to Dad, you effectively have changed your 3-step command into 3 1-step command. You understand? Okay, so be very mindful of how you give your instruction. So 3-step command, you give it 3 at one go. You're supposed to be able to do it. If you break it up, then it actually becomes single-step command.
Well done, Jack.
Okay, so the next thing we're going to do is...
Is that for me, is it?
Can we see how you are with your body parts? So can you show me where your nose is and your ears
Yeah.
and your knee? Okay, that's far too easy, isn't it? Okay, now let's see what you can do. Can you tell me what this is? What's that?
Say the words.
No.
You don't want to? Do you feel shy? Okay, no, we'll not do that then. Okay, so the next thing I want you to do is, can you take this and can you put it on top of that step? Okay, I want you to put it on top of that step.
The brick. Can you put the brick?
Yeah, on top. And now can you put it under? Can you put it under the step?
Prepositions.
Under the step. Brilliant. So
Well
it's got
done,
those
Jack.
prepositions very nicely.
Yeah.
Okay, Jack, next thing. Now, seeing as we're up playing,
So
can I see you jump?
right?
Can you jump? Oh, you can.
Yay.
Can you stand on one foot? Can you stand on one foot? Shall I hold you to see if you can do it?
He's holding the...
Oh, now if we come out into the middle of
Way.
the, can we come out into the middle of the room and see if you can stand on one foot by yourself?
Let's
No,
take the
give them
pens.
to Mummy.
We better take those away. Can you stand on one foot by yourself? 1, 2, 3, 4. Oh, you can. Another one. 1, 2, 3. Get in. 1, 2, 3, 4.
No, we do it one. Just do it once, as long as you can. 1, 2. Oh.
Yeah, that
Oh,
was
and
good.
jumping as
Good
well.
Okay, and whenever Jack goes upstairs, how does he go up? Can he go up and down by himself one step at a time? Or does he go...
Yes, but we find his concentration on coming down quite poor, so we
Yeah.
have a no talking rule, and
Okay.
he did fall down a few months ago, didn't he? So it's just, I think it's the concentration
But he
more
does
than
do
He
the
can
ability.
physically do it.
Yes.
That's brilliant.
Mommy.
And is it okay if I ask parents a few questions? So,
A Sunday.
does he feed himself?
Yeah.
What does he use to feed himself?
At the moment, mostly a spoon.
Yeah, spoon, and his hands a lot as well.
Okay, and can he, is he toilet trained at all yet? Is he potty trained yet?
Not for bowel movements, and really we've always said, okay, you need to sit on the potty, whereas lately we've been trying to get him to actually take the initiative and go, but he just says he's too busy. So we do.
So we've
He
had a few
doesn't-
little leakage. We don't have major
Just a little spot.
wetting
really.
himself.
Does he wear nappies or?
No.
No. Okay.
Only for night time and for bowel movements. He has a
Okay.
nappy. He tells us, and we put a nappy on for bowel movement.
Okay.
And I think this is down to he had oral thrush, which went right through him, and we had a real problem getting rid of it. He had it for about a year. And so when we first potty trained him, he was doing bowel movements for the first couple of weeks in the potty, and then he started saying his bum was sore.
Okay.
I think it's psychological
That's
now.
kind of affected it.
Yeah.
Okay.
But
All
I
right.
think it's improving because we're lowering the dose of ranitidine he's on, which seems to be stopping
the
the thrush going straight through.
Good.
Which we think is coming from a steroid inhaler he uses.
So from a motor point of view, I'm guessing that he can run.
Yeah.
And he can obviously jump really well, and he can stand on one foot for a few seconds and he can climb. That's great.
Yeah.
And then from a fine motor point of view, he's built a really big tower,
Yeah.
and he can draw a circle and a cross, but not quite yet
a square.
We are
almost.
working, if we position the pen correctly in his hand and stuff,
Then-
we have started getting him right in
Yeah.
numbers at home, just kind of tracing over.
It tends to be
Right.
smaller pens, as opposed to the longer ones he then holds like a fist.
Like a
Smaller
palm.
ones he then uses his fingers more, which you
And-
can then get better detail.
And then from a talking point of
Wow.
view, is he making sentences? I haven't quite got him to chat to me yet.
He's quite
Yes.
good at sentences, but the pronunciation of the words themselves can be quite poor.
Do you? What's your school called? Can you
Just
explain?
What
nurse-
nursery do you go to? No,
Do you know
he
what
knows.
does he know what it's called?
Yeah. No, you'll be going to big school soon, but where do you go to nursery?
What's the name of the nursery?
Move that. Cool. All right. Well, that's my time up. Those little
Okay.
things. So now I'm just going to summarise my findings to Hannah.
Yeah.
Thank you very much, Jack. Okay, so I've examined Jack from a developmental point of view. From a gross motor point of view, we could see him running today and jumping, and he managed to stand on one foot for about 3 or 4 seconds, but not for longer than that. And I didn't demonstrate him hopping actually. So that would put him at a gross motor development age of at least 3.5, but not quite 4. From a fine motor point of view, he was able to build quite easily a tower of 12 and might have even been able to do more if there'd been more blocks. He was able to copy across, but not really draw a square. So again, that puts him at about 3.5 and not quite 4. From a speech and language point of view, he clearly knew his colours and he could count to 12. Mum did tell me that he can make sentences, although I didn't really demonstrate that today. And he clearly knew his body parts well. So that would put him being able to count again around 3.5, 4. And from a behavioural point of view, he's not quite out of nappies during the night time, but he's dry during the day. So that's 3, and he can feed himself, which would be at least 2, 2.5. Putting it all together, I would estimate him to be around 3.5.
So that's an older child. Okay. Do you want to watch another video, or do you think that's enough? Because it's already 3 times. Do you want to watch another video or not? Somebody needs to answer. You want another video or cukup?
Another video, Doctor.
Another video. Now, younger kids, so basically your developmental assessment would depend on roughly on what you perceive the kid's age to be, isn't it? Right? The younger ones, babies, not much you can do. The older ones like this, there's a whole lot you can do. But basically, you see, this one is quite systematic because the child was quite was able to follow, but then sometimes you come across kids that don't quite follow. Then you need to go with the flow. Let's see. Okay, what's the other one? There's one where this one. This is a baby. This one should, the baby doesn't know too much. Okay, this one's a normal one. This one is quite good because you can see that the candidate follows what the child does. Right?
Okay. Hello, Katerina. My name's Emma. I'm one of the doctors. Is Is this your mum that you've got with you behind you? Is that your mum? Is it okay with you if we have a look at Katerina's development and just do some playing? What have you got in your book? That's very good.
Who's in your book, Katerina?
Who's that? You don't know? It's a girl though, isn't it? And you can see what's on the next page. Good. So you turn those pages very nicely. What about some colours? Can you tell me that colour? Ah, did you say green? Well done. What can you see in this picture? Don't know. Okay. What colour's that one? Blue. Well done. Let's see what's on the next page. Good girl. Okay. And I think this is a monkey. Do you think it's a monkey?
No.
No. What colour's that one?
Red.
Red. Okay. Good girl. What can you see now? What's this one?
Green.
It's green. And what kind of animal is it?
I don't know.
You don't know. I think it might be a frog. Can you see the frog on this page?
Yes.
Yes. Well done. Good girl. That was very good. Well, then we're nearly at the end. Can you see the frog on these pages?
Yeah.
Well done. And can you see any other animals? Do you know what this one is?
No.
Well done. You're good with your animals, aren't you? Where's the snake on this page?
Yeah.
Good girl. Well done. What colour is this t-shirt?
Pink.
Yes, well done.
So just by looking at a book, you can already test colors. You can already test, you can test fine motor, how the child's turning the pages, right? And you can see that child is pointing.
Do you know what this thing is?
That's right.
It's red, yes, you're right. Good. Do you think, Katerina, you could give the book to Mummy? Could you show me giving the book to Mummy and then we'll have a look at this one?
No.
Yeah, can you give this book to Mummy? Okay, you don't have
Can you
to,
give me the
that's
book?
No.
Why not? Can't you do some playing with other stuff? You give me the book.
fine. Actually, we've got some really exciting things in the bag. Can you give the book to Mummy? Okay.
So she's trying to get the kid to do one-step commands, right? So this is receptive language, but the kid, after about 3 times, the kid doesn't want to do it. And I might just move on because he cannot get stuck on the same thing for too long.
Go on, Katerina.
Katerina, I've got some bricks I'd like to show you. What do you do with those?
No.
Have you ever seen those before? I'll show you what we can do. We can make a really big tower. Can we get some more?
See,
Ah, you've seen my string. Okay, what can you do with that?
see, if you put the toys too close together, and then they'll get distracted by other things. But on the other hand, if the kid gets distracted, don't force the kid to play with blocks. If the kid doesn't want to play with blocks, just do what the kid wants to do. They'll be very much
Okay, so I can see that you can hold that very well. Good girl. Oh, and you wish we had some beads. You might have seen some beads. Well, no, look, Katerina, we can make a really big tower.
She's interested in
Can you
blocks.
do one of those? Oops. I have to start again. What can you make with those? Oh, have you done a bridge before? That's a little bit like a bridge. Should we try just a tower first? Let's see.
Okay, that's not a bridge because there's no hole in the middle
Very good.
where the car.
That's very good. Katerina, can I show you something with these? Can you make them so they've got a little gap in like that, so that we can have a train? It goes choo 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 choo. You can go through the bridge.
See, she's trying to emphasize
Can you
that.
make one like that? Yeah, it's very similar to your other ones, but we need a little gap so the train can go through the bridge. Oh, you can't get through. That's it. Oh, nearly. Good girl. Need a little gap for the train. Well done. Okay, that's very good. And I'll show you one more thing, and we'll see. Ooh, okay, what would you like to do? That's really nearly a bridge for our train, isn't it? Can you make a gap for the train? Make a gap for my train. Okay. Good. I'm going to show you one other thing with my bricks and then we'll do some crayons. Okay, I can see you've got your eye on the crayons. Oh, wait a second. Look, if you take that one away. Okay. Okay. And we can see how tall can you make that then? Maybe we could borrow these ones and you could put those on top of the other ones. Good. Make it really tall this side. Well done. What about if you borrow some of these and you can make an even taller one here? Put that one on top. Good. Well done. Try another one. Well done. That's 9, isn't it? That's 10. Oh my goodness, that's 11 bricks. Well done. Do you want to knock it all down? Oh, come. Well done. That was a very, very good tower. Okay. Katerina, can you do some drawing?
Yeah.
You're going to show me what you can do. I'll take the bricks away and tidy them up for you. You're going to show me what you can do with this. Thank you. Good girl. Ooh. Very nice. Good girl. And what about, you do one like this? Scribble like that. It's harder for you, don't we? Okay. Katerina, that'd be better. Thank you. Katerina, can you copy that one for me? Can you show me that one? Well done. And then what about this one? See that one? Can you copy that one? Good girl. Okay. Then we'll do one more. Really. You copy that one. You can use that colour if you want. No, that's a bit of a light colour, I think. What about this one?
Too hard.
Too hard. Okay. Can you copy that one for me? Can you have a go at that one? Not these ones, this one. Okay. Good. Well done. That's fine. You did really well. That was really, 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 really good. Now, Katerina, I think you can probably run around quite a lot. Do you think you could show me some running and jumping? Show me some walking to start with. Shall we do it together?
Yes.
Yes. Okay, good. Like her, we can do like she is.
Yeah.
Can you show your jumping? Can
Maybe.
you show your jumping?
Oh my goodness, jumping already. That's brilliant. That is excellent jumping. Okay, good. And now, that's sitting down. What about standing on one foot, Katerina? Like this. You do this, just in one place. Good girl. Well done. And can you do the other side?
Yeah.
I won't let you fall over, don't worry. You just stand on this leg. Ooh. You have another go. Don't kick mummy. Okay, and now what I'm going to do is I'm going to put this crayon. You've done it for me already. I wanted to see you bend down and pick something up, so that was brilliant. Now can you give the snail to mummy? You could give that. Good girl. And now.
Mummy,
Yeah.
these got holes.
It's got holes. What do you think the holes are for?
They're for string.
They're for string, aren't they?
Oh, hang on. You could show us that if you want to try putting the string through. I didn't realise that. This is quite tricky, isn't it? Choose one and then see what you can do. Well done. Ooh. You can put it back through another hole. Maybe if we tie a knot in the end for you, that will help. Oh, can you tie knots? It's a bit hard, isn't it? There you go. Why don't you try again putting that end through the hole? Perhaps while she's doing that, I could ask you some questions. In terms of Katerina's feeding, what kind of things will she do with eating? Will she feed herself?
She feeds herself with a fork.
A fork, okay, great. And does she use a knife at all or not yet? Okay, and in terms of nappies, is she dry during the day?
She's dry day and night.
And nights, okay, brilliant. And when she's around other children, how does she tend to interact with them?
Nicely, she shares and she's quite...
Easy.
She plays with them.
Okay, so with them. And do you ever see her pretending to be things?
Yes.
So imagining to be a princess, for example?
Yes.
She will do that, okay. And I've obviously heard a little bit of her speech today. It sounds like she's probably got quite a few words that I haven't heard. Are you able to estimate at all how many words that she will use?
Well, definitely more than 100. I'd say maybe a couple of hundred, and she's putting words of 4 or 5 words together in a sentence.
Okay, brilliant. And have you ever had any concerns about her vision or hearing?
No.
And did she pass her baby hearing test?
She did. She was quite slow to speak, so 1.5.
Look at that.
Okay, so that's a video about with a normal kid lah. So basically, it's just to show you how you can go about doing a developmental assessment. Okay. Now the site that I went to just now, the CPCH1, that's for postgraduate. When we watch them when they skip steps, right? It's because they are really postgraduate. You don't really need to do every single step. But as undergrads, you guys need to practice every single step and repeat it every single time until it becomes habit and don't skip things. Okay. I think my slides tak ada dah rasanya. Ini should So basically,
Hello Gary.
Hi.
This is your development
Okay,
section. Please could you examine Milestones? I'd like you to examine her speech and language development and her fine motor development.
Sure.
This is the one where everything goes wrong. You guys just take a note of the link lah. I'll link it for you. This one, everything goes wrong.
Mathematics development today.
The kid doesn't.
Thank you very much. Do you want to play a game? Yes. Yes, of course you do. Okay, I'm gonna ask you some funny questions. We put these here. Could you hand the duck to me, please?
Anyway, watching way too many videos.
Oh, thank you. You're very good.
If you guys want to watch that later, I just click the link in the. Anyway, this is just basically the table for development. You have the same table in all your books lah. Okay, so when you start learning, like I said, you learn across horizontally, right? Learn by progression. Then you put it, slot in the edges. It's functionally that's much better than trying to memorize at each what you're doing. Okay, and that's it for my slides. Do you have anything to ask or not?
Yes, doctor, I have a question. Kids nowadays, Asradi, doctor.
Okay.
Kids nowadays are more attracted to the smartphone, iPad, tablet, or something like that. Not the usual, the more blocks lah, like we see just now.
Muaz.
Yeah. Yes.
I tak dengar tadi. Can you repeat? Because you were breaking up a bit.
My question is, kids nowadays are more attracted to the smartphone, the video, YouTube, like that. So, is that can be an assessment too?
What do you mean assessment tool? What do you mean by assessment tool? Assessment tool for what? For who?
kids just they can use their use smartphone by their own, like open YouTube channel.
And what your question is?
Question is, kids nowadays are more their skills are more towards the gadgets now, not the toys and.
And that's why nowadays a lot of kids they have problems with fine motor and gross motor. Gross motor, because by right kids are supposed to be playing in the park. They're supposed to be running around climbing trees, isn't it? Right? So if you don't do that part of it, you definitely your development in terms of if you don't kick a ball all the time, if you don't know how, if you don't play okay, somebody who kicks the ball every afternoon and plays football with his friends will be better than somebody who doesn't kick the ball at all, right? It's all the same thing. So in terms of screen time, there are recommendations for screen time, but basically the younger you are, you shouldn't basically be on the screen, right? If you check out the American Association of Pediatrics, they do have guidelines lah. Below the age of 2 years old, below the age of 1 year, 2 years old, you don't use the screen unless it's under supervision and only for video calls, FaceTime, those sort of things, right? You cannot substitute running around with playing a game on the phone. Okay, this also, if you introduce gadgets too early to children, you interfere with a lot of aspects of development. You interfere with the gross motor, you interfere with the fine motor, you interfere with attention span, right? You interfere with social development also. Why do you need to? These type of kids, they do not learn to interact with other people, right? So there are recommendations towards using screens. You have to look it up, right? Basically, the younger you are, the younger the child is, they shouldn't be having. If you want to look at the recommendations, and obviously during the pandemic, cannot help it lah. The kids are going on PDBR, isn't it? Right? Okay. Okay, so actually, you see, until 18 months of age, limit screen use to video chatting along with an adult. Between 18 months to 24, screen time should be limited to watching educational programming with caregiver. So basically, the younger you are, the kid shouldn't be getting a phone. You see nowadays, you see a lot of kids. You see a lot of kids in 8 months old, 9 months old holding the phone and watching YouTube videos, right? When you do that, kids are supposed to be learning how to interpret facial emotions, right? They're supposed to be learning that when I talk to you, the person that you're talking with should talk back, right? If the child keeps on staring at a screen, that part of the development will be affected, right? And if the kid already has tendency towards autism or ADHD, this definitely doesn't help, right? It augments the whatever symptoms you have. So basically, screen time, the younger you are, I don't see why a child less than 2 years old should be given a phone to entertain themselves. If they want to entertain themselves, there's blocks, there is parents can play with them, right? Sing songs together, not plot the child in front of the TV for them to learn how to sing songs with Barney, right? Because the interaction is important.
Understood, Doctor. Thank you.
Any other questions now?
Doctor, I have a question.
Mm.
So after we finish from the assessment, we decide whether the child has a normal development or not, based on the corrected age, right?
Based on, sorry, what?
Based on the corrected age.
Yes, up to the age of 2 years old. Yes. Corrected age, yeah. Then, your question, Mustafa?
This is my question. So it's so after 2 years, we don't consider the corrected age, right?
No. After the age of 2 years, you use the chronological age. Because after 2 years old, there's nothing. The differences between what they can achieve that is time-based is not that significant, not that detailed, you see, because a child at 3 months old is definitely different than a child at 6 months old, right? But a child at 3 years old and a child at 4 years old, the differences, the things that happen between 3 and 4 months old is not that much, right? So somebody who's 3 months and 3 years and 3 months old, and somebody who's 3 years and 6 months old, there's not much significant difference in what they are able to do, right? But somebody who's 3 months old and somebody who's 6 months old, there is a significant difference in what they are able to do. So after the age of 2 years, you don't follow corrected age, you can just go by chronological age. Even when we plot for growth chart also, after the age of 2 years old, we do not plot based on corrected age anymore, we just based on chronological age. Okay.
Thank you, Doctor.
Question now. The speech and language link is here. You're watching on your free time. If you want the link for the thing, let's see. This is the link for the site, Myanmar CPCH. But once again, it's usually you just watch the developmental videos. The physical examination videos might be too advanced for you because they skip a lot of steps, but you can just watch just for knowledge. Done. If done already, we can just stop us already 3:40. 1.5 hours to go. Seorang tak ada Seorang tak ada. 35 je kat sini.
Saya rasa semua ada, Doktor.
Berarti bukan cakap 35 ke tadi? 34 ke 35? Class.
The total is 34.
Oh, 34 yang plus me 35.
Including
Okay.
you, so it should be still 35 lah. Betul lah.
35. Okay, betul. Siapa yang datang lambat tadi? Oh, nak angkat tangan. Siapa yang lambat tadi?
Me, Doktor.
Ni tu siapa?
Maaf, Rabi.
Razi. Siapa lagi yang lambat tadi?
Adam tadi, Doktor.
Ke mana tadi? Siapa lagi? Dua lagi. Tadi masa start 31 je kan? Siapa lagi dua yang datang lambat tadi? Tak mengaku. Okay. Anyway, Friday, the presenters hantar kat saya by Thursday morning. Latest Thursday morning. Tak payah kumpulkan. Tak payah kumpulkan sekali, hantar sekali. Kalau dah siap tu hantar. Okay, sebab kalau kumpulkan sekali, nak bagi feedback tu susah. Then the other one, kalau you finish already, lah, just pass it up. Okay. What's the other thing? Tak apalah. So individually, just pass it up. Don't group it together. Okay. Okay. Bye bye.
Doctor.
Yeah.
Can I ask for the lecture notes later? And I will email you later, Doctor.
Why you want lecture notes only lah?
For references.
References ada buku. Oh, by the way, I forgotten. Buku ada. Use your book. You don't need lecture notes. Use your book. If you want, a good book to read for development would be, if you have time lah. Kalau tak ada, good book for development would be, okay, a good book for reading for development would be this book. Would be this book. Okay, it's very thin lah. Ni about like 70 lebih je muka surat. But don't. It's very expensive to buy. If you see a copy, photo set copy you see a copy in the library, just borrow it. This is the old cover, but basically it's like this. This is an old issue, but it basically tells you by age lah what they're supposed to do. Then there's illustrations, but if you buy, it's about $100, but it's a very thin book. So I suggest if you go to the library and it's in the library, just borrow it from the library. It tells you by months what you're expecting. If not, the shower should be enough actually. Okay. Books to read. Try not to use your senior's notes. I know that's the senior's notes because that one has lots of mistakes. The one that has lots of mistakes, there's a senior notes that you guys pass to your buddies every year. That one has a lot of mistakes, so try not to use it. If you use that, make sure you read your textbook first. Textbook read. Choose either one. Either you read the Shower or you read the Baby Nelson. Please don't go and read the Grandpa Nelson. You're going to give yourself a headache. Okay. Okay, if that's all, then bye-bye. Ouch.
Okay, thank you, Doctor.
Yeah,
Thank you, Doctor.
Thank you,
Thank you,
Doctor.
Doctor.
Thank you,
Doctor.
Doctor. Thank you, Doctor. Thank you, Doctor.